When it comes to sizing of the patient, it's basically from the patient's olecranon, which is the tip of their elbow, okay, to the third MCP joint, okay, or the third knuckle, okay. This sizing is just done with a tape measure in inches, okay, where you take a quick measurement going from here to here. The eSling Express and 520 come in two sizes, and it's all based off of that measurement, okay. A standard is from 11 to 13 inches, and a long, which is the second size, is from 14 to 16 inches. The standard comes out of the bag equipped with a bicep strap, okay? This bicep strap will come in three lengths, a medium, and then inside the bag you'll have a small and long depending on what the patient's arm size is, okay? Also with the sling you will get an optional thumb strap, which will go in between the thumb, okay, to keep the wrist from falling down. You'll also get a ball on a reel, right, for any home exercise program, etc. Okay? If this ball, the patient doesn't like it on the reel, which is this reel here, it also can be put into a cage which will Velcro onto the front of the sling. Okay? These are all accessories with the sling. If it's being fitted in the ER and is not put on initially, please do not throw that accessory away. This needs to be utilized by the patient later during their recovery process, right, so we want to make sure that those patients have access to it. Now we're going to do the fitting of the eSling 520. The feature of the 520 is basically having the torso mount section, okay, but you're also going to have the cradle. So whenever you take this out of the bag, there'll be two separate parts, okay? You're gonna work with the torso mount first, so you'll get this fit onto the patient first. The nice feature of any torso mount sling is that you can do multiple positioning, okay? We'll show you with the torso mount onto the patient, okay? You're gonna have the rail that actually curves and gets molded onto the patient. You're gonna have the arm positioning arm, which the patient's arm is going to go onto, and then you're going to have what's known as the stability strap. Okay, this is going to be brought to the arm positioning rail to help stabilize it so you don't get any movement while the patient is wearing it. Okay, this could go on the right or left. Okay, and we're going to do multiple positionings with it. Okay, we're going to cut the waist belt. This one's already been pre-cut. Okay. The positioning of this torso piece is going to be at the elbow height, okay? This is not going to be at the hip. It's going to be whatever that humeral length is for the patient, okay? A lot of times we just have her grab on the outside here to sort of help to fit her out, and we're going to contour this around her body with the buckle being in the front. Like I said, this has already been pre-cut, okay? But you do have the Y straps here, okay, to help cut that, to keep this on her side so she can get to it if she needs to make basic adjustments, okay. When this is nice and secure to her side, okay, then we're able to switch the arm rail and the support strut to different positions. Right now she's set up in more of what's known as a neutral position, okay, but we also, by unvelcroing these, can set her up to other positions as well, okay? Bring her over like this, we'll bring her more into what we call the 15-degree abduction position, which is very common with physicians, like I said, is with rotator cuff surgery, okay? You can also bring her out into 30 degrees external rotation, aka gunslinger, which is basically 30 degrees from her neutral position. Every time we bring this strut to the rail, all right, we need to make sure that this is bent and is making as flush a contact as possible, okay, so the patient is secure within, all right, the torso harness. Once your position is set, okay, for this positioning, okay, for this fitting, we're gonna use 15-degree abduction. So we are coming back into this position here, okay? We always have the patient hold to give a visual of to where she'll be sitting. Once we have this secured to her side, mounts where we need, then we can get into adding the cradle. Okay? Just like the 517 Express, we're going to undo the cross strap, and the patient's going to slide her arm in. We are not going to Velcro it yet to the positioning arm. Okay? Once she is within the cradle, we're going to make sure her elbow is all the way back. We're going to get her towards 90 degrees. Okay? We're going to bring this up and over. Again, this has been pre-cut, but you're able to cut the Y straps here and also along her back. Okay? Once this is set, okay, then we need to Velcro it to the arm positioning rail. Okay? It is important to have the elbow off of the rail. Okay? So whenever you position, the back of that elbow should be about, let's say about 1 inch to 2 inches off the back. Okay, we do not want to harness that to the arm positioning rail. Okay? Alright. Now again, we can get into folding back this position of the cradle to get past her knuckles. Okay? And these are just going to Velcro back. Once this is complete, I also want to check with the patient, making sure that her arm is down into the cradle. It is not shrugging her arm up from pulling the cross straps, and that also that this shoulder strap is adjusted over top her shoulder, not too forward, not too back. We can also add our accessory features, such as the the thumb strap, okay? And we also can add our bicep strap to keep the elbow back. Once this is completed, we can add our little ball onto the rail so the patient can get to it for any part of her home exercise program. We're going to start off with the eSling Express, okay, which is your basic sling, no pillow, right? No torso mount. Okay, but it does come with the waist strap. So we'll show you how to utilize the crossbody strap and the waist strap. What you're basically going to do is just unhook the sling, the waist strap, and the crossbody strap. In this case, we're going to do the patient's left arm. Okay, she's just going to slide her arm into the sling. Okay, positioning the elbow all the way back in the cradle. Next thing we're going to do is bring over the crossbody strap and click it into the clip. Okay? This can be done with a single finger. Okay, so for example, if the patient is by themselves and doesn't have someone to help them after surgery, where they could just clip it in like that. Okay? With keeping the patient's elbow at 90 degrees and with the elbow back into the cradle, okay, we're going to position this crossbody strap. Okay? It is very important through the strap there is a sewn in pad here, okay, which needs to go over top the patient's shoulder. Okay? This obviously is for comfort. Both of these straps have a Y strap on them, okay, or what we call an alligator strap. So this strap can be cut in the front and the back to position this padding. Okay? We're going to try to keep this strap in the front of the patient so she can get to it with her opposite arm, okay? So she does not have to reach over top of her shoulder into her back, which would make adjustments pretty difficult. When this is positioned, okay, her elbow should be at 90, her elbow should be all the way back into the cradle, and her arms should be relaxed down into the cradle part of the sling. This sling should not feel like it is hiking her shoulders up, or what we call a shoulder shrug. Sometimes a fitter can pull these straps too far and it actually drives her shoulder up. Okay? So we'll always recommend to the patient, make sure that they're relaxed down into the cradle, but yet at the same time not feel like it's shrugging the shoulders up. After this is in a comfortable position, okay, and her elbow is all the way back, we will assess where the cradle goes past her hand. A feature of the eSling Express is that you can fold back the cradle for proper sizing. In general, we do not want this cradle to go past her knuckles, and you're able to Velcro this down like this on both sides. We want the patient's hand to be free for any type of use, for any type of exercises. Okay? After this, we can utilize the waist strap. So this will just come around the patient's body. Okay? Again, this is able to be cut in the front and the back. Okay? We're going to want to keep this strap to her side for basic adjustments. Okay? And also it has a pinch release tab here for her to get in and out of. After this is complete with the cross strap and the waist strap, okay, we can add on our accessories. Okay? One of those accessories being our ball, okay, on the reel. Right? That can just go on the inside of the sling so the patient can get to. She can even bring it to with her other hand to this hand. Okay? And then we're going to find the correct length bicep strap to keep her elbow back. Okay? Positioning of this strap is usually in the front of the elbow, right here. Okay? Again, keeping the elbow back so the hand doesn't slide forward, and thus she gets what we call wrist drop. Lastly, we have the optional thumb strap. Okay? This thumb strap goes in between the thumb here to keep the patient, again, from not having any type of wrist drop, okay, and keeps them secure, wrist straight within the cradle. An alternate connection for the waist strap, besides it being up here on the crossbody strap, we have just moved it to below the arm cradle. So this attachment can either go up to here with the clip, or you can bring it down here, right? Whatever is most comfortable for the patient, or preferred by your physician. Both the eSling Express and the eSling 520 come with a optional neck unloader strap. To apply this strap, it's going to be by color, to where the teal is going to match up with the crossbody strap, and then the navy blue, or the darker blue, is going to attach to the waist strap. What this strap is going to do is to pull this away from her neck, hence unload her neck, and get the pressure more over the shoulder, which is adequated to take that pressure. With the Y straps and with the Velcro facing you, you're going to attach this to the cross body strap and also attach it to the waist strap. As you are pulling this away from her neck, you're going to fasten this strap down. This will hold the strap away from her shoulder. You would optimally want to cut this utilizing the Y strap, and it would be Velcroed on the back side of the patient along the strap here. This will hold the strap off of her neck, right, and make the strap more comfortable for her to use the sling. Another feature, turn back around for me, of the sling is the optimal sizing, okay, of the cradle. To get to its smallest size, you're able to fold this back along these seam lines. To get to the smallest size, you're going to have to undo the neck strap attachment and move it over to the innermost border. Okay? As you do that, you can fold this back because you want the cradle to be hitting before her knuckles into the mid-hand. Okay? You're able then to fold this back to make a nice collar here, okay, which will stay sturdy to make it comfortable on the top portion of her hand. You would then readjust this, okay, fold it nice and neat, and adjust the Velcro, which is on the back side, securing the strap on both sides. So thus now you have a nice collar through the mid-hand, in the front and the back, optimally sized for comfort. Another feature of the eSling Express and the eSling 520 is the dropout feature. This is very useful for patients to do their home exercise program, and they do not have to take the sling completely off. Okay? To utilize the dropout feature, the patient will just undo this tab here, and the arm will drop out so he or she can do their home exercise programs. Okay? Once they're done their program, they bring this back up to elbow at 90 degrees, elbow all the way back in the cradle, and then bring this back up and Velcro securely, and now they are back into the sling.